Hi, everyone. We're delighted to have one of our beloved colleagues, Erin Walker, with us for today's Expert Lounge Talk. It's so wonderful to have you, Erin. And we can say at our clinic, Wellist, we absolutely love collaborating you. We share office space with Erin, and your passion for taking care of women and your passion for collaboration are something that we love. So welcome.
Thank you. Thank you so much. It's so wonderful to be a part of this group with you guys. What is Chinese medicine? And, a lot of people obviously know there's this rich history in Chinese medicine that dates back for thousands of years. And it's those teachings that have been passed down that inform us today. And I think allow us to really support patients in its own unique way. So even 3,000 years ago, there are texts talking about gynecology, talking about fertility. And so we use that information very much now as was done all those years ago. This very specific construct has been taught generation after generation. Acupuncture kind of comes in and it has this energetic view, which we think of as more macroscopic, if you will. So people will always say, like, what does that mean? Energy, this energetic view. And we think of the body in an energetic way, in that there is a specific flow of energy through the system, through pathways. We call them meridians. And there's 14 main meridians in the body through which this energy flows. So as an acupuncturist, our challenge is to try to figure out where are those imbalances in the system and how might they be contributing to whatever this person's main complaint. And if we're talking about fertility, what might be getting in the way of their ability to conceive from an energetic point of view.
What can the tongue tell us?
So the tongue is fascinating. And
say more. I love
it. Once teaching a course, it's a first-year course to understand tongue diagnosis, because our tongues look wildly different from one another, which you would not know otherwise, right? So on the tongue, we look at several parameters. We look at the color of the tongue, which can range from really, really pale to purple, bright red, or even dark gray looking. We look at the coat of the tongue. We look at the shape of the tongue. Some are very thin, some are much thicker. And there's a topography as well that corresponds to the meridian system. So it really helps inform our diagnosis.
Can you say a little bit more about the detailed menstrual history and the significance of length of cycle, spotting, and then color, and I guess, I don't know, quantity, or like heavy versus light? And can you speak a little?
Yeah, so a lot of the meridians that we're looking at in Chinese medicine we think about the meridians that influence blood. And so we think of blood sort of energetically in a way beyond just what we think of as blood, menstrual blood, or blood in Western medicine. And there are differential diagnoses around the nature of blood. It's really interesting. If you look at the male factor piece, is pretty telling. Sperm counts have really dropped dramatically over the last 100 years or so.
That also speaks to the question of who are appropriate patients to send your way, right? So I'm thinking PCOS patients, sperm abnormalities, or any issue going on male-wise. Even the unexplained infertility, when you said everything can be totally fine and they're like, just keep trying.
And so we think a lot about the concepts of yin and yang. I guess we haven't really touched on that, but those might be terms you're familiar with. So this interdependence of these sort of energetic influences that work together and are constantly morphing one into the other. So every meridian has a yin function and a yang function. And so part of our diagnoses will be, what's the relative state of yin and yang? So somebody might come in and be more yin deficient versus more yang deficient.
What happens with the yin and the yang when your patients get pregnant?
Yeah. So, I mean, we still want to support the core diagnosis, because the more imbalanced somebody is when they become pregnant, the more likely that they're going to have just an easier pregnancy. Pregnancy is a time of, that's rich with qi and blood, right? So we really want to support that. Treatments are often very gentle in pregnancy.
And Erin, what does the induction treatments look like when someone's looking, they're 40 weeks and looking to do anything to have the baby? What
Yeah,
is
so
that?
I'm always a little bit hesitant with the word induction, just to set
Totally.
people's expectations, right? So it's not like taking Pitocin. We're not gonna throw someone into labor with a few acupuncture needles, but we can encourage the process. And so there are certain points that are known to have effects that would be beneficial. So in particular, a point that is spleen 6 that I will teach patients how to use on their own with acupressure is thought to have a close relationship with the cervix and encourage that cervical ripening.
Well, thank you so much, Erin, for taking time out of your busy schedule and for really just inspiring us to keep wanting to broaden our own networks and really provide interdisciplinary care.